Hi, today we're going to talk about using a modified Bondy scale. To begin with, the University of Southern Queensland would like to acknowledge the traditional custodians of the lands and waterways where the university is located. Furthermore, we acknowledge the cultural diversity of Aboriginal and Torres Strait Islander people and pay respect to elders past, present and future. The university respects and acknowledges our Aboriginal and Torres Strait Islander students, staff, elders and visitors who come from many nations. So today our learning outcomes are going to be to understand the Bondy scale, to be able to apply the Bondy scale in practice, and to use the Bondy scale with the University of Southern Queensland students' assessments. So to begin with, we'd like to introduce the Bondy scale. It was first developed in 1983 by Kathleen Nowak Bondy. The criterion referenced definitions are designed to decrease inconsistency and subjectivity in clinical assessments. It's a way to ensure consistent and objective assessment of student skill progress despite variations in clinical placement and assessors. So this is the Bondy scale, and we use this for both the 26 learning tools and the formative and summative competency assessments in the midwifery practice portfolio. Skills assessments are spread across the length of the 2-year course so that development of skills is incremental. There are 3 criteria that the Bondy scale assesses. Professional standards for the procedure are interpreted in terms of safety, accuracy, effect, which is achieving the purpose of the behaviour or procedure, and affect, the manner and demeanour of the student. The quality of performance refers to the degree of skill development. This encompasses the use of time, equipment, space, and expenditure of energy. Does the student anticipate and use time efficiently? Do they expend excess time in attempting to anticipate the next step, for example, rechecking equipment or repeating of behaviours? The type and amount of assistance required is broken up into 2 types of cues. A supportive cue, which may be, well done, keep going, you're doing well, or a directive cue, where you will need to give verbal or physical instructions. There is a 5-point rating scale used for grading, broken up into independent, proficient, assisted, supported, and dependent. The scale is not designed so that independent is something only to be attained when the student is ready to be endorsed as a midwife. The level relates to a beginning level of midwifery practice. So remember, skills are gained incrementally and the students can repeat the assessments to show progress in development. Students midway through a course may be assessed as assisted, for example, and this is appropriate and expected. They will revisit these criteria later in their course before completing each learning tool. So how do we decide whether a student is independent or proficient? Both achieve the professional standard. Both are safe and accurate and effective. It comes down to the quality of performance. So independent has listed as proficient, whereas proficient is listed as efficient. So proficient is being practiced and fluent at the skill, whereas efficient is being effective without wasting time or resources. There is a difference in time frames where one is expedient time frame and the other is a reasonable time frame. And the difference also with assistance required, independent does not need supportive cues, where proficient may have received occasional supportive cues. Either of these rankings in assessments show competence of the skill. So deciding between proficient or assisted. The professional standard achieved in proficient is most of the time in assisted. The difference in quality is between an efficient, coordinated, confident response, whereas assisted is inefficient and lacks coordination. Occasional supportive cues for proficient is replaced by frequent verbal and occasional physical directive cues in assisted. Is it assisted or supported? Assisted is skillful in parts of behaviour, and they have some safe and accurate, effective most of the time in their skill, but they are inefficient and lacking coordination. Whereas supportive, safe, but needs to be supervised. They perform at a risk and not always accurate. They are still unskilled and inefficient, and they require continuous verbal and frequent physical skills. Cues. So dependent in relation to supported, are they unsafe? Are they unable to demonstrate the behaviour? Are they able to perform the skill? So it is quite unusual for a student to request assessment and then score a dependent. So using the scale in practice, we're using it to judge the quality of the performance. Are they skilled and coordinated? Is the student understanding what they're doing, why they're doing it? Is there evidence of critical thinking? Are they confident and relaxed? Is the time taken reasonable? And are they able to maintain their focus on the woman? So it's about confidence. Remember, consultation is always allowed. A student can absolutely be confident in their skills, but still need to consult, still need to ask for advice and input from more experienced practitioners. So can we trust that this student will perform this skill without supervision once registered? Part of being independent is knowing their own school limitations and scope of practice. So can we trust this student to say, I can do that and I can't do that without help? They need to know when to engage further input and consultation with others that they will use for the rest of their career. So in summary, a modified Bondy scale is used to try and standardise student assessments. It's using objective and consistent ratings, and we use it with University of Southern Queensland's skill learning tools and for the formative and summative clinical assessments. We have confidence that students are capable, competent and skilled when they are marked so on the Bondy scale. We want our graduating midwives to understand their own practice abilities and know when to seek further consultation. Thank you for listening.